I'm in Ireland 15 years. I still find it hard to cope in wintertime. But again, I think this is the general feeling as my other colleagues would experience in the winter months. But if it's more intense or prolonged, that it qualifies for seasonal affective disorder. So bipolar disorder, also called bipolar affective disorder, is a mood disorder in which the mood fluctuates from being depressed to being elated. The periods of depression would have the similar feature as someone who has a major depression would have. For example, low mood, persistent feeling of sadness. They may feel tired or lethargic during the day. They may have problems with sleep and their appetite. They may lose weight. They may have these unusual thoughts about not being around anymore. And again, as we said, that these symptoms should meet the criteria for major depression if they are prolonged for more than 2 weeks at least. Along with these depressive episodes, the patients with bipolar affective disorder have other episodes of elation, which we called mania or hypomania. So a mania is a more severe form of hypomania. They have increased energy. They may feel they are on top of world. They feel great about themselves. They may believe that they have special abilities or they have special mission. They are here to save the world. They may have these unusual thoughts about talking to God or talking to angels. They may be very hyperactive. They may feel that they don't need to sleep anymore, that they can actually just keep going on maybe 2 to 3 hours sleep. And because of these mood abnormalities, they can actually get involved in risky behavior, for example, overspending or like rash driving or inappropriate sexual relations. And these symptoms should last for about 7 days for the diagnosis to be made. So mania is a more severe form in which patients have these abnormal fixed beliefs, and most of the time they need hospital treatment. A hypomania is a milder form in which they have these experiences, and they generally get better with the medications at home. So the presence of delusion actually signifies that somebody is manic. A hypomania, they have these thoughts of grandiosity. They may feel great or they may feel angry and irritable, but generally they don't have delusions. So if someone has delusion, that actually means that they are manic, and this is a more severe form. It's important that bipolar affective disorder may coexist with other conditions, for example, personality disorder or substance misuse. So it's very important to rule out those conditions or to address those conditions if they are present with bipolar affective disorder. And other times, the symptoms of the emotionally unstable personality disorder may mimic bipolar affective disorder, and this is very common in clinical practice. So dysthymia or dysthymic disorder is a mood disorder in which the symptoms of depression may persist for more than 2 years. There is a chronic low level depression. What happens that the patients feel that they are depressed, they have been trialed on numerous medications, they feel a bit better, but they don't feel back to where they were before they became depressed. It is generally more resistant to treatment compared to the major depressive disorder. The patients feel that they have actually never regained their previous level of functioning in dysthymia. But again, the lines of treatment is the same. There are medication and there are psychological treatments. So if someone comes to you with the symptoms of depression that are present for a few weeks to a few months, you can't tell whether they have a depressive disorder or dysthymia. So if the symptoms resolve well with the treatment, then you say that this was a depressive episode. But if the symptoms persist despite trialing numerous medication or other treatments, and if it crosses the 2-year mark, then you would say that they are dysthymic. A seasonal affective disorder is a disorder of affect, which means mood, that is related to the particular season. So in this disorder, the patients may experience symptoms of depression, but they are related to the particular time of the year, which is like autumn and winter, in which the daylight hours are less. So they may feel more depressed, more lethargic. They may have more problems in terms of socializing with other people, and these symptoms they may interfere with their functioning in their personal life, their social life, and in their occupational domain. It is normal to feel a little bit reclusive in winters, given that the day is so short. So if these periods of mood disturbances are more prolonged compared to the usual day-to-day dip in mood, then it may qualify for the seasonal affective disorder. Now, in order for this disorder to be diagnosed, it's important that there is a pattern observed for a number of years, because we can't just say based on what happened last winter or like for the last 2 years. There has to be, generally the patients who suffer with the seasonal affective disorder, they have this mood abnormality going on for a number of years, and in that case it's easy to make a diagnosis. I just need to put it in a personal context. So I'm from a different background, so so I'm in Ireland 15 years. I still find it hard to cope in wintertime. But again, I think this is the general feeling as my other colleagues would experience in the winter months. But if it's more intense or prolonged, that it qualifies for seasonal affective disorder. Essentially, the treatment for seasonal affective disorder is the same as for any other depressive disorder, that there are certain medication that can help you improve your mood and improve your functioning. There are other psychological treatment that you might take. And if you note a pattern that your mood dips around September, October, so you can actually put a plan in place, maybe just ease yourself, maybe manage your stress, prioritize your sleep, and again, it's very easy to overlook the physical activity when the winter comes. So just make it, maybe think more actively about how you'll be more proactive in terms of your walks or exercises.